Okay, so to me, a logical consequence of thinking about care coordination and the relationships among people in teams is taking up a really important set of issues around professional behavior and professional codes. Um, in the traditions of health professions, professionals are supposed to be self-regulating, are supposed to adhere to some codes of conduct and practice, and we have a number of ways that policy tries to regulate that behavior, but we also expect that professionals will regulate their own behavior in certain ways. And so here we're going to be thinking about some of that tension between self-regulation and external regulation. I'm going to be introducing you to some professional charters and codes of ethics, and I'm going to be telling you about an important new type of legislation to increase the transparency of professionals around managing their conflicts of interest. In this section, I'm relying a lot on the work of my colleague, Dr. Eric Campbell at the Mongan Institute, who really over the last many years has studied closely a number of issues of professional conduct and professional behavior. And unfortunately, some of the things that he has found and has learned really relates to these issues of these interprofessional conflicts. You can imagine that in this highly charged climate, there will be times where you get people really at odds about even, who can do that procedure, who can prescribe that medication, who can manage this patient. And we see bubbling up in some places, and this isn't widespread, but we do see periodic disruptive behavior when people get frustrated in these very high stress situations. They're doing work that is rapidly evolving and sometimes in critical situations, and so you do get interprofessional conflicts and disruptive behavior. We also have seen really over time that these issues have always been there. They change a little bit, but with the stress of these professions and with the access these professionals have to medications and substances, there have always been small amounts of professional conduct issues around substance use and abuse. People trying to stay awake, people trying to manage sometimes very long days or stressful situations with legal or illegal drugs. And so you will see, if you look at state registration, boards of registration, you will see a lot of disciplinary conduct around substance abuse issues, and most hospitals have specific programs to deal with this issue. I would say there's also been a big focus on conflicts of interest. We rely in a healthcare system where there's a lot of innovation, where you're always trying to find new tests, new devices, new medications, new treatment approaches. There inevitably are relationships that form between the industries that produce those devices and medications and the professionals who want to have access to the latest thing and test it and run the clinical trials. And so in many cases, those relationships, when physicians were sort of self-employed, a lot of those relationships were not as easy to see. But over the last decade, we've seen more employment of physicians, by physician organizations and hospitals, and people have really started to probe those relationships and how they might influence professional behavior. And that's really where we've gotten into a number now of both institutional policies around disclosure of external relationships and increasingly some federal regulation. So what defines how physicians and nurses are supposed to behave? And you've probably all heard about the Hippocratic Oath, and you may have heard that nurses take an oath that is based in part on Florence Nightingale's work in the last, 2 centuries ago now. But in modern times, we've had a series of organizations forming more contemporary professional charters and principles of responsibility, which really move beyond those traditional oaths and credos and codes and try to say, what does a modern professional look like and what kind of behavior should we expect? And I think The American Board of Internal Medicine Foundation has really led with a physician charter that has been around for about a decade. It's been adopted by a number of organizations. They try to put the focus first on how do we behave in a way that puts the primacy of patient welfare at the center of what we do. Can we, as we care for those patients and make that our primary relationship, take the other relationships that we have and put them a bit to the side and limit the influence of those external forces in our patient care? Can we respect the autonomy of the patient, which may mean in some cases giving up some autonomy on the part of the physician? You know, can we say we're not going to make all the decisions for people, but we're going to let them make some themselves? There's also in here an element of social justice and a professional responsibility to care for the poor, and a number of commitments to maintaining your professional competence, to updating your education, improving knowledge, and behaving well. You'll find in the American Nurses Association Code of Ethics very similar provisions. I think that beginning with, again, the primary commitment to the patient, the dignity and worth of individuals, something that you find in nursing charters that's a little bit different is this third one, which is nurses seeing themselves really as an advocate for the patient. Somebody who will be the patient's voice in an organization. In some cases, you know, we've seen physicians interpret this as a voice for the patient against me, the doctor. And that's where some of these, I think, professional conflicts come up. You know, you certainly want patients to have advocates in these settings, but that very laudable goal may also be a little piece of some of the conflict that we see between nurses and physicians in some of our healthcare settings. The conflict of interest piece has come under, you know, considerable federal interest. And so the final thing I want to tell you about in this segment is something called the Physician Payment Sunshine Act. It's a new law, effective last year, that really requires not just doctors to report their relationships, but requires all those companies who may be funding research or funding clinical trials or employing physicians as advisors to say, you know, we are going to report the amount of money that we are paying to physicians and we are paying to hospitals. We're going to disclose that, and we're going to make that accessible through the federal government websites to anybody who wants to know. Of interest here is that you would think that this would all have been maybe broadly opposed by these companies, but in fact, many companies were in favor of the passage of this act as a way to help them manage, you know, the public perception around these relationships. And so over time, you're going to see transparency reports that will open up the prospect of understanding these relationships and knowing whether your doctor or your hospital has received money from a number of different sources in industry. And the link to that website is available to you here. So that is a very brief summary of issues around professionalism in the health professions.